Hello beautiful people, welcome to another video. In this video I'm going to be talking about my prereqs that I need for nursing school. This is going to be specific to my particular college that I'm applying to. Also note, if I do accidentally slip and say the name as I did in my previous take of this video, I'm just going to like bleep it in editing. So because oh god, I had like 7 minutes of the video done and then I was like, I just said the name of it. So I'm not going to be saying the name of it. Basically, if you're interested in nursing, no matter where you are in life, whether you're starting college, whether you're in the middle of your college journey, whether you're out of school and this is like you coming back to change careers, wherever you are, your first thing should be to look at your local program at a local university, or maybe if you're looking at out-of-state or online programs. I don't know if online is if there's any fully available online nursing program, but look at any available accredited school in your area first to see the prerequisites that you need. Don't assume that because you've taken a class before that's automatically going to meet your prereqs, because sometimes some schools might have a statute of limitation, so to speak, or a limited time period of like, okay, yes, you took this class, but we need you to take it within this time frame. So if you took it like 12 years ago, 15 years ago, they might require you to take it again. So that's something that you should be aware of. Definitely look at whatever program you're interested in. If you are looking at multiple universities, make sure you have like an organized system of like each of their requirements. Like, you don't want to assume that just because one school wants something, another school wants something. So try to stay organized with what each school needs and make sure you can meet those requirements. Attend info sessions where possible, or like reach out to an advisor or something to find out information and make sure that you are going in the right direction, because the last thing you want is to start applying and realize, hey, I don't actually qualify for this program, or hey, I haven't actually met all the prerequisites. That would be terrible. So especially if you are able to do all this way before the deadline or way before the application opens, it's gonna save you a lot of peace of mind. So I'm gonna go through the prereqs and kind of the curriculum for my intended school, and whether I've met certain prereqs, maybe even how those classes went for me, and then yeah, we're just gonna kind of go through it just so you can have an idea of what to expect, I guess, especially if you're someone who's maybe in high school and you maybe just want some information, or someone who again is coming back to start a new career. This is going to be my take as someone who's currently in college after several gap years and who is finishing up college this semester, going to be preparing for applying to nursing school and all this stuff. So I'm applying to an accelerated bachelor's program. I don't want to do a BSN. I'm not doing another 4 years of college. I'm not. This ABSN program is 12 months, which is very fast. And I'm looking at the 1-year curriculum right now. I'm not gonna list every single class, but it is 4 quarters. This one I'm looking at is from spring to winter. So spring session has 5 classes. Summer session has 5 classes. Autumn session has 8 classes. And winter has 5 classes. And I believe autumn is switched. So spring is heavier, and then, or autumn is lighter, and then the spring is the heavier one. So that's also important to notice. If you're not used to an accelerated course or accelerated programs, you are going to want to keep in mind what your course load is going to look like. So also while you're looking at your prerequisites, also try to take a look at the course load to see what to expect. I talked about my experience with accelerated classes in my undergrad in another video. You can definitely check that out. I don't think I gave a whole lot of information, but I basically talked about some of my struggles in dealing with an accelerated program, and kind of how I hope to apply my experience to an accelerated nursing program. So that was the curriculum. Let's look at the prereqs, which I already know the prereqs, but I want to, just go over it. Also, for an accelerated program or a regular BSN, you're getting a bachelor's degree. So whether you have a bachelor's already, an ABSN or whatever, like, you're getting a bachelor's degree. With the ABSN program for this particular college, you do need to have a bachelor's degree already. I believe that the ABSN programs I've looked at have all required you to have a B bachelor's degree already. So keep that in mind. If you haven't already obtained a bachelor's, that's something to note. Some might be okay with you having associates, but again, look into that before you just start applying. Okay, so the prerequisites, let me see. Okay, so admission requirements: a bachelor's degree in a non-nursing field, or enough time to complete a bachelor's degree in the time to start the program, which makes sense. If you are a senior and you're going to be graduating by the time you apply to the program, you're fine. You want to have your bachelor's before you start, again, for this particular program. You want to have a cumulative GPA of 2.8 for all completed college level coursework. That is for this program. Look at your program, because some might have higher GPA requirements, and you want to make sure you meet that before you start applying. At the time you submit your application, at least 3, okay, so this is where the prereqs might be a little different. They separate it into natural sciences prerequisite courses and non-natural sciences. And I am gonna go ahead and open that PDF so that I can explain those. I can't show it to you because it has the name of the college. But yeah, so it says for the natural sciences prereq courses, you want to finish with at least 3 of them need to have a GPA of 3.0 or higher. No expiration date for prereq courses. However, you may wish to retake a course if you need a refresher. So for this particular program, you don't have to retake courses. There's no time limit. So if you took it a long time ago, you should probably, I wouldn't say like pay for a whole college course unless you want to, but maybe look for, like, I personally love the For Dummies group of books because they break things down pretty easily. And I have a bunch more coming tomorrow. I'm so excited. And I'll go over that in another video, but you might just find a textbook online to review information, or at least get a little bit of a refresher, not go and pay like thousands of dollars or hundreds of dollars for a course just yet, unless you want to. So notice how they say that the cumulative GPA should be 2.8, but for the natural science courses, they want you to have a 3.0. So that's important to notice. I personally think that it's pretty generous that they say that at least 3 of them need to have a 3.0. That's pretty nice. Like, some of the programs I've looked at have been really strict or have expected a lot more of you. So again, look at your program. and again, no expiration date. I'm gonna go into those prereqs in just a second. Another thing that I don't say this is unique, but I didn't see this in other programs. At the time when you submit your application, you need to have a minimum of 100 hours of paid or volunteer healthcare experience in one setting within a 3-month span, completed within 12 months before applying. So basically, in the year before your application is due, this application is due October 15th. In the year time span from October 15th last year to October 15th this year, I need to have 100 clinical hours, which I don't have yet. I plan on getting it this summer. If this wasn't within the 12-month span, I would have this, but I don't. It's within a 12-month span. So, and you need to be able to have, based on what I saw on the application itself, you need to have someone you can reference that can verify that you did that, like a nurse or, you know, a unit secretary or someone who can verify that you did 100 hours. Notice that it says paid or volunteer, but it's really specific. It has to be one setting. So even if you're working in multiple healthcare facilities, you need to have 100 hours in one setting within 3 months. Now, if you're working, this is probably going to be really easy because you can do that in 1 month, right? Super easy and chill. That's what I plan on doing. However, if you maybe volunteer, it might be a little more difficult. So something to keep in mind. Again, something I haven't seen in every program. Some programs are like, hey, you should probably be comfortable with a healthcare setting, but it's not required. This program is very adamant about that. A clear understanding of the registered nurse role, hopefully, you would have that. So for that, again, working in a healthcare setting would be useful. I've kind of talked about in my other video about my EVS job, how I personally see that some of the tasks and roles translate to nursing, based on what I've observed about nursing. I also follow a bunch of nursing schools and nurses online, so that's been really helpful because I get like little bursts of wisdom or just experiences daily about like what they go through, and it's been really cool, because I'll learn things that I wouldn't have expected. Meet essential qualifications for ABSN students. This is also a separate document, which we'll see if I need to go into that. English proficiency and transcript evaluations are required for international college level coursework. Okay, so yeah. So in this particular college, it says you can also apply as a post-bac student, which is separate. Okay, so yeah. And for this particular school, if you're applying to the School of Nursing, you also have to apply to the university separately. And if you're also applying to like the joint DNP program that they have, you have to apply to that separately. So admission to one doesn't guarantee admission into another. So be mindful of all of those things when you're applying to a nursing program. I feel like I'm talking too fast and I'm like, oh my god. And going into the application materials, notice how it didn't mention a letter of recommendation in the program requirements, admission requirements, but it is in the application materials. So you need academic history, list of all colleges attended, official transcripts. So again, making sure you have access to get your official transcripts is very important. Prerequisite courses. If you're in progress with courses or planning to take them, you have to list that. Experience in training, describe healthcare professional, volunteer, or leadership experiences, include relevant trainings and language proficiency. Essays respond to required prompts about your motivation, preparation, and alignment with the school's mission. Optional statement to address academic concerns if applicable. Based on what I saw in the application, I thought that was really cool. They give you a chance to explain, like, if your grades were a bit lower, or you dealt with something personal or medical or whatever, and it affected your academic performance, you get a chance to basically attest to that and provide more detail, which I think is really cool. And then you need one recommendation addressing specific questions. Now, I do have a recommendation lined up. I don't know if it's written yet, but I have someone that I respect greatly. I used to work with them at my previous job. They are a registered dietitian because that was the job I was in, and I haven't had clinical experience this year thus far. So if I have no other options, I'm going to request this person to do my recommendation. They're aware of that. However, for the application, it does stress having a nurse as your recommender, getting a recommendation from an active nurse or medical professional. So be mindful of that if you need a letter of recommendation. Again, you may be like, well, that's obvious. It may not be super obvious. I am someone who I haven't had a traditional college experience, and so letters of recommendation aren't something that are easy for me to access. So if you're in the same boat and you are maybe unable to get that, or for whatever reason, find someone who's able to attest that you would be someone who would make a great nurse. That's basically what the recommendation form is asking. Would this person be a good nurse? Get someone who would be able to visualize you in that field, who may be somewhat aware of medicine in that way, and that they can talk about it in that context if you don't have someone who's directly in the field. I wouldn't recommend getting like a family member. That wouldn't be the best thing. I would say that maybe if it's someone who has like a different last name, for example, maybe you can get away with that. I'm not saying anything, but if you have like familial connections, go ahead. It is not recommended. But again, if it's someone, I would say if it's someone who has a clear, distinct last name from you and they can be impersonal in terms of not referencing you as family in the recommendation, go for it, right? But be mindful of that if you do need a recommendation. If you have more of a non-traditional path like I do, try to find the next best thing if you can't get a nurse. Okay, so that is everything required for the application. We're gonna go into the prereqs. There are 6 prereqs, which isn't a lot. For this particular school, they do have like a form that you can fill out, and then they encourage you to send it to like a counselor to review, and that person will review them. You have to fill out like in detail the course, the school, and I'm sure they do research into the school to see, you know, what the program looks like, and then your grade, your GPA, all that stuff. And this was how I found out that I needed to retake nutrition, so this is helpful. Statistics course, which I had. One course minimum of 3 quarter credit hours or 3.0 or grade or higher grade required. The natural sciences. Okay, so let me go back a bit. So remember we said natural sciences as like the ones where you need to have at least 3 as a 3.0. The other 2 courses that you need that are outside of natural sciences are statistics and lifespans growth and development, which is developmental psychology, lifespan psychology, or other similar title. I am going to be taking developmental psychology next semester, next session in like a week, and nutrition I just took. Statistics I took previously at my first college. For natural sciences, minimum of 6 courses, 28 quarter credit hours, 3.0 grade or higher required in each course. Okay, so that wording is a little bit different than the previous wording. So again, I would verify with your college what you need, because I have it open still. On here it said on 3 classes, at least 3 of the natural sciences with a GPA of 3.0 or higher in each. Okay, gotcha. That was my mistake. I didn't read the whole school. So they wanted you to have at least 3 of the prerequisites done at the time of your application with a 3.0 or higher in each one. So you need a 3.0 in the natural science courses, but you can have a 2.8 average GPA for all your classes. And if you've attended multiple schools like I did, you have to submit all your transcripts. So there's general chemistry, single course or series. For me, it was 2 courses at Rutgers. Organic chemistry, single course or series, which I have. I've taken general chemistry 1 and 2. I've taken organic chemistry 1 and 2, and I've taken the lab this past semester. Human anatomy and physiology, at my college, it was 2 separate courses. It was systems physiology and anatomy at Rutgers. I took them in the same semester, and for anatomy, it was anatomy and anatomy lab together. So some schools might make it anatomy and physiology 1 and 2, whatever, or separate them, which is what mine did. So those I've met. General microbiology, I did technically meet that at Rutgers. Do I remember a single thing from that class? I don't think so. However, if it's anything like cellular bio that I just took, then I should be fine. But I have biochemistry up here. I do want to get one for microbio. There's going to be a list of courses that I plan to review over the summer, including anatomy and physiology. So that's going to be one of the things I'm going to review. Nutrition, which I just took. I also have a nutrition textbook somewhere up here from that college that I went to that wasn't accredited. And I did also just take it, so I have all my notes from... I did not take many notes, actually. I didn't take any notes for that course. So I have a little textbook, and if I really want to, I might buy the textbook from this past class I just did. And then, like I said, developmental psychology. So out of all of these prerequisites, I personally only have developmental psychology left. I'll be taking it next week for like 7.5 weeks. And then I'll be done. And I will have met all of my prerequisites by the time I graduate. So that's awesome. I'm very grateful for that. But like I said, if your college doesn't have something like this where you can fill out a form, still do something like this anyway if you're not sure about your prereqs. So your college might list the prereqs, but if you're unsure about your school, if you're unsure about whether a course you took was accredited, things like that, you want to make sure all your courses are going to be accepted. Make sure that you kind of maybe send them your transcripts. I don't know what your program might have available. It might just be admissions, but it might be a specific department that you send them to. maybe to the School of Nursing specifically. Send them, an email, ask them about their prereqs, ask them if this would be accepted or not, etc., and just find out if it would be accepted. Like I said, the worst thing would be opening the nursing application when it opens up. This one opens up in August. You have like 3 months to do it. I think the worst thing would be opening it in August and going through it, because I like to try to go through the entire application and see what it needs, and then realizing, oh shit, I don't meet the requirements. So this is also, again, why I'm kind of going through this. This is all specific to this particular college, but it might help you have an understanding of what you might need. Especially if you're not sure of what college you want to go to. This is also helpful because, again, you'll have an idea of what to expect if you haven't committed to a school yet. I feel pretty fixed on this school. This has been my goal for the past 8 months, that I want to go here and I want to do this. I moved to the state to go to this school. I'm working at the hospital for this school, so I really want to go to this school. So yeah, just do your research, check out multiple schools if you need to, check out the requirements. If you don't meet the requirements, do what you can to meet them, or if you don't meet them, try to look around at other schools. Maybe you might start off wanting to do an ABSN, and then you realize maybe a BSN might be a little more beneficial for you. I talked about a little bit in my kind of comparison of accelerated programs or accelerated courses, how I've found myself struggling with motivation, focus. I found myself kind of struggling to, at first struggling to find a rhythm, create routines. Those are things that I've personally struggled with because the college I'm attending currently has accelerated classes. So I'm kind of using it as a kind of launching ground to see how I would do in a program like this. Accelerated, I'm pretty sure these classes are also 7.5 weeks. So I like to think that I already am getting a little bit of a little bit of experience with it. I'm seeing how I would do in it. It doesn't say on here, but I'm assuming the classes are roughly 7.5 weeks, maybe shorter, maybe longer. They're just broken up by seasons or quarters. And I'm taking 4 classes, and I'm a little bit overwhelmed. These are 5 to 8 classes. So I'm very intrigued at how I would do with this. I'm not gonna lie. Let me see if there's anything else I would want to. This might not be super necessary, but I'll just go over this really quickly. It had a link for essential qualifications and behaviors for accelerated nursing. I'm not gonna go, it's a whole thing. I'm not gonna go into each thing, but I am gonna talk about, just mention the titles and subheadings. So essential qualifications and behaviors, motor skills, sensory and observation skills, and it breaks it down into ABSN versus graduate programs, which is interesting. I'm just gonna go, you know what, let's read a little bit. That should be a little bit. So under motor skills, it says have sufficient motor function to execute movements required to provide general care and treatment to patients in all healthcare settings. Perform basic life support, including CPR, and function effectively in emergency situations. Safely assist patients in mobility, example, moving from chair to bed, wheelchair to commode. I'm just gonna say this as someone who has been trained as a patient care tech several years ago now. If you were a CNA or a PCT, that is already something you know how to do. So there you go. Under sensory and observation skills, acquire information presented through demonstrations and experiences in the basic and nursing sciences. Observe a patient accurately, both at a distance and close at hand. I laugh because I need my glasses to see at a distance. My eyesight has gotten progressively worse over the past few years, so I need my glasses to be able to see someone from afar at a distance. Observe and interpret nonverbal communications when performing nursing assessment, interventions, or medical administration. Perceive signs of disease and infection through physical examination, imaging, palpation, and auditory information. Example, patient voice, hearts, bowel, lung sounds. I will interject. I am very excited at the idea of learning like all these different signs and symptoms to be able to identify certain things in people. I know as nurses we're not allowed to necessarily diagnose a patient, which I find to be weird. Part of the reason why I want to become a nurse practitioner and go on to like doctorate. But I've heard of people saying like, oh yeah, my nurse, whoever person in my life is able to just look at people and know what's wrong with them. And I'm like, I love that. I'm so excited to do that. Communication. Communicate effectively and sensitively with students, faculty, staff, patients, families, and other professionals. I will say if you have retail experience and you're good at customer service, you've got that skill covered. Express ideas and feelings clearly and appropriately. Demonstrate willingness and ability to give and receive feedback, very important. Communicate effectively in oral and written forms. Convey or exchange information at a level sufficient to develop a health history, identify problems, explain alternative solutions, and give directions during and after treatment. I know that one of the things that nurses do is basically teaching the patient before they leave how to do certain things, how to do like wound care, how to transport patients, especially to like family members as well, when to take their medications, how to take their medications, how to administer things. So I think this is again me interjecting. If you're someone who isn't good at explaining things to others, this would be a good time to start working on it. If you have a partner, I think a lot of people talk about like explaining things to their partners as they're studying. I think that's a great way. I personally just talk out loud to myself. So that is also a good way to like talk out loud. Just hear how you sound. Like maybe you need to work on your tone and how you say things. Maybe you find that you're a little too high pitched or you talk a little too softly, which I do. You can hear it on the phone, but in person I do tend to talk very low, and going at a high volume or talking louder is uncomfortable for me at times. However, I can like usually project when I'm in a room or something. So work on things like that. Even if you're just talking to yourself, work on your auditory, verbal communication and styles, and rehearse in the mirror or something. Again, especially if you're someone who struggles with communication. I am also that person. I don't struggle with communication because I've had many years of experience in customer service and like managerial roles. However, I do still get like that introverted like nervousness of having to talk to people, and sometimes I will rehearse things in my head. But usually when I'm in person and I'm talking to someone, I'm just like, this is just a person, it's not that big of a deal, and I can usually get through it fine. So yeah, but a lot of practice can be helpful. Process and communicate information on patient status accurately and in a timely manner to members of the healthcare team. So knowing how to summarize information, knowing how to get the important information out first. Like, I know a lot of people who read things as they are. I am also that person, especially if I have it written down. But if you have a patient that has like high blood pressure or high blood sugar, for example, and you need to get that treated right away, you start with that right away. I feel like if you're giving a report, you shouldn't have, like, if it's like a long-term thing that someone needs to be aware of, that's one thing. But if it's something that needs to be treated right away, I feel like you shouldn't be just like casually giving a report and then you're like, oh yeah, and by the way, this person has like high blood sugar and they're probably crashing. Like, no, you deal with it. Anyway, cognitive abilities: measure, calculate, reason, analyze, integrate, and synthesize information in the context of undergraduate nursing study. Quickly read and comprehend extensive written material, evaluate and apply information, and engage in critical thinking in classroom and clinical settings. There's a lot of stuff here. There's a lot of stuff here. Hold on. Okay, I don't. Okay, there's like 2 more sections. I'm gonna go through them. If you are not interested in all this, you can click off. You are all good. If you're curious, just stick around a little bit. The next one is one more under cognitive abilities: evaluate and apply information and engage in critical thinking in classroom and clinical settings. Behavioral and emotional attributes: all students possess the emotional health required to fully utilize intellectual abilities and exercise sound judgments. Demonstrate behaviors consistent with timely completion of responsibilities. Maintain mature, sensitive, and effective relationships with patients, students, faculty, staff, and professionals under all circumstances, including highly stressful situations. Have emotional stability to function effectively under stress and adapt to environments that may change rapidly and unpredictably. Demonstrate empathy for the situations and circumstances of others and communicate that empathy appropriately. Recognize that personal values, attitudes, beliefs, emotions, and experiences affect perceptions and relationships with others. Be accountable for behaviors or actions that convey racism, bias, or discrimination, and engage in reparations as appropriate. Be willing to examine and change behaviors that interfere with productive individual or team relationships. Demonstrate the interpersonal skills necessary for effective and harmonious relationships in diverse academic, professional, and community environments. And then we have professional conduct: possess the ability to reason morally and practice nursing in an ethical manner. Abide by professional standards of practice as well as relevant regulations for applicable licensure. Not engage in unprofessional conduct. Demonstrate attributes that include compassion, empathy, altruism, integrity, honesty, responsibility, and inclusiveness. Engage in patient care delivery across all settings and with diverse populations, including children, adolescents, adults, developmentally disabled persons, medically compromised patients, and vulnerable adults. in case you are curious of all the skills you would need as a accelerated or just general nursing student. Those are all the things. So yeah, I hope this video was helpful for someone. I think I expected to go into a lot more detail, but I mean, if you have any questions, definitely leave them below. I'm going to be kind of sharing my application process once I get to it later in the year, so stay tuned for that. If you have any questions from like an undergrad perspective that maybe I can answer, leave them below and I will answer them either directly in the comments or as a video, and I will talk to you guys in the next video. Bye.